Affectionate and warm greetings from Worldify to all of you who are watching this video. This is our special exam episode on the expected exam questions for our 15th April exams. So welcome you all to this particular session. We are going to specifically cover the expected question for your letter writing for your OET exams. Okay. So once again, welcome to Worldify, and let us straight away get started. So we are expecting a refer back case for April 15th. No, this time we are expecting a refer back case to be given to the students. No, again, so this is our guess based on the pattern that we have seen being followed by the OET Academy. So now what is a refer back case? Let's first of all understand what is a refer back case. So a refer back case, first of all, is going to be a known case. So which means that the recipient, the person who is reading this letter, knows the patient. And it could be, so example one could be that the patient is a resident of community retirement home, correct? He came to the hospital for treatment of a medical condition. Yeah, let's say example. Yeah, he is now stable and is being discharged back to the community retirement home. Okay, this is our first example. One scenario when we speak about a known case. Yeah. Now, again, when we speak about, yeah, so let's speak about the second example for refer back. Second example is basically you were, the patient was referred to you. Let's say the patient was referred to you by his or her GP for a specific treatment. Okay, for a specific treatment. The treatment is now complete and you are referring the patient back to the GP, right? So just stay on these two examples. So that is these two examples are good enough for you to understand what is a refer back case. So a patient was referred to us for a specific treatment. The treatment is completed. Now you are referring the patient back to the person who referred you this patient. So it could be a resident of the community retirement home going back to the retirement home after the treatment for a specific disease or sickness. It could be a patient being referred to the GP after treating him for the condition that was requested by the GP. Now, this is what a refer back case is all about. So we will discuss one sample case note, which is a refer back case note today, and we will see how we can start writing our letter. So let us briefly look at the case note. Again, so now when we start reading the case note, we know we should start reading it from the writing task. So this is the portion that we are going to read first. No, so we know, write a discharge letter. So we are writing a discharge letter. It becomes a refer back case. I'll tell you why. And we are writing to Ms. Georgine Punsford of resident community nurse at the community retirement home, and this is the address. So this letter is going to accompany Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So when Mr. Ramamurthy is going back, when you say Ramamurthy back to the retirement home, because he came from the retirement home, so he is going back there. So this is one way of identifying whether the patient is being referred back. Another way is basically, if you see the retirement home, address of the retirement home, it's 103 Light Street, Newtown. And when you compare that with the address of the patient, you will see the same address being mentioned, right? Community retirement home, Newtown. So this is again another clue, another clue left there for us to make out that this is a refer back case. Okay. So now, okay, so this patient, Mr. Ramamurthy, is the name of the patient. He came from the community retirement home. He is going back to the retirement home after the treatment. We need to write a discharge letter. And all of us know when we write a letter for a non-case, you would not include the medical history of the patient, because this is something that the recipient will already know about the patient. Okay, so now let us look at the letter, the case note a little more elaborately. So today's date is 10th February. So this is your date on the letter, correct? So simultaneously, let's complete this before I simultaneously start writing the letter. So you have Mr. Lionel Ramamurthy, a 63-year-old patient. Okay, admission and discharge dates are important. Yes, so these are important information. He was diagnosed with pneumonia. Yeah, he was diagnosed with pneumonia. Past medical history, I don't even have to bother about it because I will not be including it. Again, social background. So all of this information is not required for me in a non-case letter. Because why? Now you might ask me why this is not required. Imagine you are a nurse at the community retirement home. Let's say you have 150 patients in the retirement home. Don't you think you will have a file for each patient in the retirement home? You will be maintaining a medical record for each of the patients, each of the inmates, and the medical records that you have there will contain all this information, right? So whether he is suffering from osteoarthritis, what is the quality of his eyesight as of today, who are his near relatives, what was he previously, all of that information is going to be there in the medical records. So you don't have to tell them. They know all this information, and most probably when they referred Mr. Ramamurthy to your hospital, they would have given this information to you for your information. So don't include this. That's why we say we should not include any past medical history or social background in a non-case letter. Okay. So now again, medical history, right? So I do not want to speak about the medical history. Yeah, medical background I need to know, because the nurse, Miss Georgine Punsford in this case, right? Miss Georgine Punsford. So you're going to write to Miss Georgine Punsford. She does not know what happened after the patient was admitted to the hospital. So you should detail out what was the condition of the patient at the time of admission and what treatment was given to the patient. What is his condition today? And what is the expected follow-up actions that Miss Georgine Punsford should do for the patient after the patient is back at the retirement home? So this is how you will structure your letter. Okay. So let us now start writing the letter. So you know the symptoms. He was admitted with pneumonia, right? So the diagnosis was pneumonia. He was admitted with pneumonia, and then he had these symptoms of shortness of breath, wheezing, cough, fever, symptoms of fever. He could not walk on his own. He could not complete activities of daily living on his own. As of today, what is the medical progress? He's now afebrile. He does not have fever. Inflammatory markers are back to normal. He is able to walk slowly and shower independently. Dry cough, some chest and abdominal pain. So due to cough, there still remains some chest and abdominal pain. He has gained weight, which is a great thing, 1.5 kgs after review by the dietitian. Okay, now this is the nursing management. This is the advice to, or this is this is the advice to Miss Georgine Punsford on how to take care of this patient after he is back. Okay, so let us now look at writing the letter. Okay, so date is 10th February. The patient's address, to whom are you writing this letter? That information is here. So with that information, we are writing the letter. Okay, here we go. So let's go to the next page. I am using the red ink so that it is more visible to you. Let's start writing. So the date is 10 February, no commas, 20. 19. Okay. To whom are you writing this letter? Miss Georgine Punsford. Who is she? No, she is resident community nurse. Resident community nurse. Community retirement home. Okay, resident community retirement home, and 103 Light Street, Newtown. Okay. Now again, the next one is regarding information or the reference information. So RE colon, you're going to write about Mr. Lionel Ramamurthy. So comma, aged 63. So he's a 63 years old person. Correct? So you can see that in your introduction of the case note, right? In the first part of the case note, a 63-year-old, Mr. Lionel Ramamurthy. In this case, I don't see the date of birth. If the date of birth was given, I would give priority to the date of birth. So I don't have the date of birth. So I am going with the age. Mr. Lionel Ramamurthy, aged 63. Okay. So you're writing to Miss Punsford. So you can, dear Miss Punsford. Okay. You can put a comma here, right? And, okay. So let me just, yes, save the work as we go ahead. Okay. So, yes, dear Mr. Punsford. So now this is where we should start writing your purpose paragraph. Now I'll give you a few templates here for you to follow while writing the purpose paragraph for a refer back case. First of all, you need to ensure that your examiner knows that you have understood that this is a refer back case. So now how will you write this? How will you write this, right? So one way of writing it is, I am writing to update regarding Mr. Ramamurthy, comma, a non-case of yours, a non-case of yours. So I'm giving you an update. So you know this patient, I'm giving you an update. Okay. Non-case of yours who is currently recovering from pneumonia. No, he requires further care and monitoring at your facility after his discharge tomorrow. So he's going to be discharged tomorrow in this case. Now, how did I figure that out? So if I look at my today's date is 10th February, right? And the discharge date is 11th February. So his date of discharge is tomorrow. Okay. So I'm writing to update regarding Mr. Lionel Ramamurthy. No, so I'm using few words here that makes it very clear. So one is update, right? I am using this word update here to let them know that I know this is a non-case. I also very specifically called out that this is a non-case of yours. Okay. So, okay. So this is one version. So I'll give you another 2 more versions that you could follow, right? So yeah, let me give you another 2 more versions. So again, this is one version. I can call it as version number 1. So version number 1. Okay. Now let me give you another version, how you can write it. Okay. So now this I call it as version number 2. No. Another way of saying it is, I am writing regarding Mr. Ramamurthy, a resident of your facility or of your retirement home, resident of your retirement home. Okay. So you're telling the recipient that this patient is a resident of yours. So which means that this is a non-case. Who is currently recovering from pneumonia. The rest of it will remain the same, right? Who is currently recovering from pneumonia. Recovering from, again, you will say he requires further care and monitoring at your facility. So I'm saying at your facility because this patient is going to be there in their facility. No, that's why I'm saying at your facility. Now let's quickly see version 3 as well. Version 3, so we will again, we have another way of, doing that. Okay, so okay, let us just look at these two sentences. Okay, okay. So another way of writing it is, okay. So I think I'll just write the first sentence here. So I think this is not going to change. This time I'm going to rewrite the second sentence. He is currently stable. No, he's currently stable. But requires further care and monitoring at your facility after his discharge tomorrow. Okay, so that is what we are going to write. Okay, so let me just move this a little up so that we have enough visibility of these paragraphs. Okay, so you can use either of these purpose paragraphs to ensure that or to let the examiner know that this is a non-case, right? So here we are saying a resident of your retirement home, which is very clear, saying that, okay, you know this patient. Again, a resident of your retirement home, you use the same thing, but here we have kind of changed the second sentence. No, he is currently stable but requires further care and monitoring at your facility after his discharge tomorrow. So now what you would follow the same thing, right? You would follow the normal stuff that you would do about that you would do when you're writing a letter. So the purpose paragraph is done. The next paragraph is basically the condition of the patient at the time of admission and what is his medical progress. So when was the patient admitted? So if I take a look at it, he was admitted on 4th of February. He had acute shortness of breath, wheezing problem, symptoms of fever and generalized ache. And he was not able to walk independently and shower independently. Okay. So we'll start now. So 4th February 2019 is his admission date. So we'll start by saying he was admitted on 4th February 2019 with complaints of acute shortness of breath, right? Acute shortness of breath. What is it? Wheezing difficulties, symptoms of fever. So symptoms of fever is high temperature as well as rigors. Yeah, symptoms of fever and the general ache and general body pain and general body pain. Okay. In addition, he could not mobilize or carry out his activities of daily living independently. So he wanted some help, no? So pick up frames, assistance, or somebody else's help for activities of daily living. So this is how we summarize, instead of just detailing out whatever you see there. So if you see that big paragraph, we have summarized it in just 3 lines. Now, he was admitted on 4th February 2019 with complaints of acute shortness of breath, wheezing difficulties, symptoms of fever, and general body pain. In addition, he could not mobilize or carry out his activities of daily living independently. Okay. Now, he was diagnosed as having pneumonia. So with all of these symptoms, he came in and we diagnosed that he had pneumonia. Today, he doesn't have temperature, so he's no symptoms of fever, afebrile, right? Doesn't have temperature, and his progress is overall satisfactory. Okay, he is able to independently walk short distances, right? And shower and shower independently. No, he's able to independently walk short distances and carry out his act and do his activities of daily living. Okay. He's able to independently walk short distances and do his activities of daily living. So earlier at the time of admission, he was not able to independently do this, but now he is able to do this. That's what we are mentioning in the letter. So that is how we have summarized. Okay. Okay. And I think we need to speak about the weight gain of 1.5 kgs. I think that is important. On a positive note, so this is positive thing that you want to speak about. On a positive note, he has put on, instead of saying put on, 1.5 kgs of he has put on 1.5 kgs of weight under the review of the dietitian. Yeah, this is an important thing that you're highlighting. Okay, so now usually in our letters, the second paragraph would be, so this is your second paragraph, right? So this is your second paragraph, right? So this is your second paragraph, which is your condition of the patient. And this is your first paragraph, which is your purpose, right? This is your first paragraph, which is your purpose. This is the second paragraph, which details out the reason for admission and then what is his current condition. Okay, and yeah, this is paragraph 1. Now, ideally, your paragraph 3, right? Ideally, your paragraph 3 would have been medical history. No, this is not required in this case. So you will not write anything. No, so you don't have to write any medical history because we said this is a non-case. No, so you will not need any medical history to be written. So this is not going to be there. So yeah, and then you will start your next paragraph, which is this is called your discharge plan. Okay. So now how will I write the discharge plan? So discharge plan is what you find in the nursing management and the discharge plan specifically. Okay. And of course, so we start writing, kindly ensure that he, okay, so encourage oral fluids, proper nutritious diet. So kindly encourage the patient. Encourage the patient to consume, to consume what do you want to oral fluids, right? So oral fluids and nutritious food such as, so they have given you a list of nutritious food, right? So now if you see your case note, they're speaking about what is eggs, fruits and vegetables, right? Foods such as eggs, fruits and vegetables. Okay. So kindly encourage the patient, okay, to consume oral foods and nutrition such as vegetables. Yeah, and you also need them to monitor the same, and you need the nurse to monitor. So not only encourage the patient, but ensure that he is following it. That's what is called by, that's what you mean by monitoring somebody, right? Now, what else you need? He has to walk as per the physio's guidance. And, you need to encourage chest physio exercises, right? Okay. So, please make sure that he is walking and carrying out chest physio exercises as per the directions given by the physiotherapist. Okay, so you have completed that part as well. Okay, and then about sitting, right? So please note that the patient maintains a sitting posture in order to sitting posture. Why do they need that? In order to ensure postural drainage, right? In order to ensure postural drainage. Okay. In order to encourage postural drainage. Okay. So then another thing. So paracetamol is the another one. No, paracetamol. So if paracetamol could be given if he complains of stomach or chest pain. Yeah. So if they have stomach or abdominal pain, yeah, they can give paracetamol. So this is the discharge plan, and this becomes your paragraph number. In this case, it is paragraph number 3. Usually, it is number 4. No, in this case, we are not writing your medical history, so this becomes your paragraph number 3. Okay. So now you need to conclude. This is your conclusion paragraph. So So your normal conclusion, you have covered everything that is there in the case note. If you have any further queries, please feel free to reach out to me. Simple, right? Just you can by heart this, and then you can keep using this for all your letters. If you have any further queries, okay. So if you want to write one paragraph before, but again, I would not encourage that because it would increase your word count. So maybe you could also write, in view of the above, request you to provide the necessary support to the patient. You might want to write that, but then I wouldn't write that if my letter is already lengthy. In view of the above, request you to provide the required assistance to the patient. If you have any further queries, please feel free to reach out to me. I would leave this optional if you have already reached your word count of 180 to 200 words. Okay, that's it. No, the letter is done. So yours sincerely, right? Yours sincerely. Then you can put charge nurse. I don't think they given the nurse's name. They have not given the nurse's name in this case. Have they given the hospital name? I think they are given the hospital name. So they have said you are a charge nurse. That's it. They are not given you a name. So you can just say charge nurse. And the hospital name is Newtown Public Hospital. So you might want to keep that again. Newtown Public Hospital. Okay. So this is such a simple letter, right? So don't get led away when you say refer back case or update the patient. So when you say update, you need to update about what happened to the patient during the time he was in the hospital, he or she was in the hospital. Okay. And we also just be very careful about your introductory paragraph, no? Your purpose paragraph. Use either of these to ensure that you have some of these keywords to give that hint to the examiner that you know that this is a known case and this is a refer back case. And this is where you need to pay attention, because this is the first paragraph your examiner is going to read while he is assessing your letter. Hope that was clear. Once again, we thank you. Worldify Academia Hub thanks you all for watching this video. If you like this video, remember to click like and subscribe to our channel for further for similar updates in future. And this was a session where we discussed the expected writing questions for our exam on 15th of April 2023. For all out there who are attempting this exam on April 15th, best of luck, give in your best, and come out in flying colors. Thanks, everyone. Once again, signing off. This is Sancho, the master trainer at Worldify, signing off for you.